I'm Kirk Jowers, and welcome to the FAQs episode of the doTERRA COVID-19 series with Dr. Russell Osguthorpe, the Chief Medical Officer of doTERRA and a board-certified pediatric infectious diseases specialist. Thank you so much for watching, commenting, and asking questions. And here are a few of your most frequently asked questions for the week of March 23rd. Russ, thank you for being here.
Thanks. It's good to be here. This should be fun.
So, when you say families need to be practicing safe distancing, do you mean that we all, the entire family, needs to stay 6 feet apart at all times?
No. So family members can be in the same home and be close to one another and care for one another and support one another through difficult times. What I'm saying when I talk about families is distancing yourselves from other families. And where the rubber hits the road here is when your teenagers want to get together with other teenagers and they want to come spend time in your basement or spend time in the backyard together or do whatever it is that your kids want to do together. Right. Or when your friends want to come over and have dinner at your house. What is too risky or not risky? I would recommend that families try and limit their exposure to other families at this time. But within the family unit, you're good.
And I suppose I should expect this question. Why aren't you, Kirk, and Dr. Osguthorpe sitting 6 to 8 feet apart? And I'll take this one. Thank goodness doTERRA invested in CGI, and we're actually we can fit David Sterling's entire family between us, but Luke, no, that's not true. We are about 3-4 feet apart.
Yeah. So we are not physically distancing, but we have made some important risk decisions about how we would mitigate risk. And every day when we come in to do these, we have asked before we even arrive, are you symptomatic? I'm not symptomatic. Is Luke symptomatic? Shout out to Luke. So essentially, and you remember that we used to have 20 some odd people that would help us make these, and now it's just the three of us. So we are doing everything we can to both provide a public service while as well mitigate risk. And there may come a time as the pandemic progresses and in our local environment where we would no longer do these face-to-face, where we would be at distance from one another if we were still doing these several weeks from now, for example.
That makes sense.
And can I add that, as a healthcare provider, I worry that when I'm taking care of patients that I might actually get sick with the virus. And if that were to happen, we wouldn't do these, right? I'm not going to come in. I'm not going to expose you. I'm not going to expose Luke.
Right.
I'm going to self-isolate, self-quarantine the same way you would if you were sick. And we would expect everybody around the world to do the exact same thing when they had symptoms.
Yes. So playing off of that, how long must we stay quarantined to assure that we are not carriers before we can safely resume visits with individuals, family members, coworkers, friends?
The best answer we have right now is 14 days is the quarantine period. So if somebody is exposed to a known test positive case and was a close social contact, that person would be placed into quarantine for 14 days. And we've seen that number with many famous people as well as non-famous people who have been quarantined based on exposure. So that's the answer, 14.
And you kind of answered this already, but to be clear, this person asks, and several have asked, they have grown children who live all over a city, a town, so different households.
Sure.
If they all self-quarantine for 2 weeks for these 14 days, would it then be safe to all gather in one of their homes?
Okay, Kirk. So yes, possibly, if everybody were absolutely 100% faithful to quarantine, theoretically you could do that, but human beings aren't like that, and that would not be smart, nor would I ever advise that. Because
that would mean they probably didn't eat any takeout food. They didn't take their kid to the playground, even when it was empty, because there may have been something there. I mean, all the things you just said play into this. What is a true self-quarantine?
Quarantine is different than physical or social distancing. Quarantine is you are kind of in a room by yourself, no exposure to the outside world for 14 days.
Right.
That's not what we're doing right now with physical and social distancing. Right now what we're doing is we're saying 6 feet apart, small groups, those sorts of things. No churches, no movies, no Broadway shows, right? But
So I'm pretty much physically distancing myself from everyone but my household, my family household, but even my adult kids who live away, we conferenced in, we didn't get together, and you, so you're essentially my
yep,
you and Luke
we're
are
kind of
essentially
family now,
my
right?
family on that, yeah.
So we limit our social circles. We do everything we can to decrease the likelihood that the virus can be transmitted. So in answer to the individual question that was received, no, I would not recommend that a family try to quarantine themselves and then get together for a family activity in 2 weeks' time. Although theoretically that might work.
And the final question is, people want to know what is the most common question you personally receive?
It's been interesting. I've been asked by lots and lots of people, what am I doing in this situation or this situation? But the most common question I receive is, how are you managing the questions of kids coming over to play? What are you doing? Does your wife go get her hair done?
What are the ages of your children at home?
My children at home range in age from 18 to 16. And we recently had our daughter, who's at university, move home. So now we're at 20 to 16.
Okay.
And I'm hopeful that our other son at university will eventually come home, because I'd like to limit that exposure as well. Because if he were to get sick, he'd be coming home for us to care for him.
Right.
And I'd rather him come home before he gets sick rather than come home and bring the virus home. So
Yeah.
we're having conversations with our adult children as well as our teenage children about risk and about how we think about our individual choices that we make every day around who we spend time with and how we spend time with them. And I try and give practical answers to folks about that, but in general, we're severely limiting our contacts at home, severely. And we're going to do so for a period of 2 weeks because we want to flatten the curve and we want to keep our ICU beds available for people who need them, and we don't want our hospitals to be overrun. In the last week, while attending at our local children's hospital, I was included in conversations about what would happen at our children's hospital if the adult hospitals were full and how we would need to help potentially pitch in. And that's happening in many countries around the world right now, in Italy and Spain and France. We need to make tough decisions right now as individual families. And so I answer that question of what are you doing in your individual family by saying we're trying to limit our contact severely. And we're going to do it to flatten the curve. And we hope that that time frame will be 2 to 3 weeks and not longer, but we're going to do it for as long as it takes.
Thank you, and thank you for joining us.